Well, hello again, Mr. Jones. It's your nurse, Rachel. How are you doing? Good, I'm glad to hear it. So, as you know, we've encountered an issue with your urination, huh? Yes, I know. I don't know what else we can do. We tried laying down, we tried sitting up, we tried with the water running. We're running out of options. So, what I'm gonna do is after I did that bladder scan, I noticed that there is urine in there. We're just having a difficult time releasing it. So, with that said, what we're gonna do is I'm gonna insert an in and out cath. Or have you ever heard of a straight cath? Okay, so you've heard of it. It's all I'm gonna do is I'm gonna go ahead, clean you up, and then I'm gonna insert this tubing into your urethra. I'm sorry, I can never say it. Urethra meatus, and then drain out what's in your bladder, and then I will slowly remove it. And that's how we're gonna have to do it for right now. But I'm hoping that promotes, it kind of encourages your bladder to relieve itself naturally. Um, does that sound okay? All right, Mr. Jones. Well, I'm glad to hear that. So, with that said, I have to ask you, are you allergic to latex? No? Good. How about shellfish? I know that's odd. It's in our cleansing solution. Okay, good. I'm glad to hear that too. My grandma is. I always thought it was the strangest thing. And now I'm meeting more and more people who are allergic to shellfish. Yeah, it's surprising. Another thing that I need to ask is, are you allergic to betadine or iodine? Okay, perfect. Well, then we are good to go. Alrighty, so what I'm going to do is I'm going to go ahead and wash my hands and then grab some gloves and then I'm going to clean you up. Alrighty? Okay, so first I'm going to raise the bed, not your head. I'm sorry. Okay. Are you comfortable? Good. Okay, so I'm going to bring you to about right there. And then, since I touched this bed, I'm going to wash my hands again just in case. And then grab a pair of gloves. All right, Mr. Jones. So before we get started here, I'm going to go ahead and give us some privacy. Alrighty. Yeah, I know. The weather's getting a little better. Day by day, spring will be here soon enough. So I've got these washcloths. I'm just going to put it on my side table that is at a working height. Alrighty. So first, what I'm going to do is I'm going to go ahead and just bring this blanket down a little bit, and then I'm going to expose you just from the hips to the knees, okay? Alrighty, thank you. So first I'm going to go ahead and take a clean wash rag and clean from the top to the bottom of his inner thigh on the far side. So go like that. And then if I need to wipe again, I'm going to go ahead and switch the side of the cloth. For every stroke I do when doing pericare, I'm going to switch to a clean side of the cloth. So then I'm going to go ahead and come to the other side, his inner thigh closest to me, down, and then switch. Do it one more time. Alrighty. And then dispose of that towel. Grab a new one. And then I'm going to go ahead and in circular motions clean around the urethra meatus. And so I'm going to do one circular motion there. And then switch to a clean side. And then one more time, Mr. Jones. We're getting there. And then go ahead and clean that again. Okay, and then dispose. After that, I'm going to go ahead and clean the shaft of the penis. So starting from the top, and then down, clean side, top, and then down, clean side, top, and then down, clean side. And then one more time, top and then down, clean side. All right, and then I'm going to dispose of that. Now, Mr. Jones, I'm going to have to get your backside, so if you would go ahead and grab onto that sidebar. I'm going to roll you over nice and easy. Are you ready? All right. Good job. You barely needed my help. Thank you. Okay, so then when I clean his backside, I'm going to go from scrotum up to the bottom. And then I'm going to go ahead and change to a clean side. Go ahead and do that again just to make sure it's nice and clean. And then, all right, Mr. Jones, you can go ahead and roll back. Thank you. Oops. All right, now I'm going to go ahead and dispose of my dirty linens and remove my gloves, making sure not to touch anything with my contaminated gloves. And then I'm going to go ahead and wash my hands and apply my PPE to prepare for the sterile procedure. So what that entails is I've got my goggles on, I've got my mask on, which I would need anyways, and I'm going to grab some gloves first. Okay. Hi, Mr. Jones. So, as I mentioned, I'm going to be preparing my sterile area. So, with that said, if you could refrain from touching me, touching my supplies, and just touching anywhere basically from your hips down would be fantastic. Otherwise, my sterile area is no longer sterile, and then we will have to restart the procedure. Which, I know it doesn't sound too fun, does it? Alright, so we're in an understanding then, I guess. Okay, so what I'm going to ask you to do, please, is spread your legs a little better. Is that okay? Alright, wonderful. So since he can't do it, I'm going to do it for him. But that would not be with my gloves on. Alright, so, you know, Mr. Jones, before we get started, I need to straighten you out a little bit. Alright, is that better? Okay, good. I'm glad. Alright, I'm going to remove my gloves because I touched him. So, from here, I'm going to go ahead and I'm just going to wash my hands again because my patient was a little wonky and I wouldn't allow that if this was a real procedure. So, here I have my sterile kit. I'm going to go ahead and lay this down. Sorry. Okay. So I would have already had those blankets down all the way. But this is my bag I'm going to use just in case I have some trash that I need to throw away. Alright, and then I'm just going to open up my sterile area. I'm going to go away from me, and then to the sides, and then open that up. And then I'm going to take out my pad, my blue pad. The blue side goes facing down. And what I'm going to do then is kind of get it under his thighs and scrotum. Oops. To ensure that his bed doesn't get dirty. Alrighty. And then I'm going to go ahead and remove my gloves and then wash my hands. Alrighty, Mr. Jones. So next in my procedure, I'm going to go ahead and apply my sterile gloves. And to do this, I'm going to go ahead and use your belly area, if that's okay with you. Alright, thank you. So whenever I open this, I am going to go open away from me. And then throw that away. And then whenever I grab this, I am going to first unfold. I've got these 1-inch margins that I'm going to stay in the whole time. So whenever I open this, I'm going to go ahead and fold those out, and then kind of flip these ones up like so. Alrighty, and then I'm going to grab, so first I have both my hands are ungloved. No. Okay, I'm sorry, that didn't happen. Everything's going perfect. So I'm going to take my non-dominant hand, my left hand, and then put it on my dominant hand, my right hand, only touching the inside of this glove. So that hand goes in here, and then like I said, only touching the inside. Go ahead and get that in there. And then with my gloved sterile hand, I'm going to kind of grab like the thumb and then insert my fingers under the cuff, kind of like that. Only touching the outside. I will not touch the inside on this one. So then I put my left hand in there, and then still outside only. And then there. So the outside of the glove does not touch your skin. It never did. Alright, it's perfect. So what I'm going to do is I'm going to pick up this from the sterile inside and set it aside. You don't want to get too far from the sterile area. So just set that aside. And then what I'm going to do next is I'm going to finish kind of unwrapping my kit. So this I'm going to use in a little bit. I don't need that right now. What I do need is my lid to my urine specimen. And then I'm going to go ahead and add the lube to the top of that lid. Okay. And then set aside. Nope, hang on. I didn't leave the sterile area. I'm just going to set it aside in the sterile area. And then after that, I've got my betadine right here, which is right here. And so what I'm going to do is first, I need to cover him. So what that means is I'm going to do this. So I'm going to take this and kind of drape it over here. Now this is going to be my non-sterile hand. So I'm just going to go ahead and kind of arrange it like that. And then from here, this hand will not move for the rest of the procedure. So I'm going to get a good hold on it. And what I'm going to do is I have my iodine, my betadine Q-tip, and I'm going to go ahead and just cleanse the urethra meatus. So I'm going to start kind of lower and then go in a circular motion, grab a clean one, go up a little higher, circular motion, clean one, and then I'm going to do it again in a circular motion closer to the site where I'm going to be inserting the catheter. Alrighty, and so now that that is cleansed, I'm going to go ahead and take the tubing. First I'm going to scoot this a little closer, but I'm going to take the tubing and go ahead and get it really, really saturated in the lubricant. And then I'm going to go ahead and tell Mr. Jones here, how are you doing? Are you okay? Good, I'm happy to hear it. We're almost done. This won't take much longer, okay? I know you're glad. I understand. I don't blame you. So what I have to ask of you is that I'm going to begin inserting this tube. What I want you to do is bear down, which means basically act like you're about to urinate, okay? All right, but relax. Go ahead and relax. So I'm going to kind of shift this upward a little bit and then Mr. Jones, I'm going to go ahead and enter, okay? So I'm going to go in slowly. You all right? Good, I'm glad. We're trucking along. Okay, so there's your prostate. What I'm going to do is I'm going to kind of go in back and forth motions to kind of ease it in. And then I'm going to keep feeding this tube until just about to the bifurcation, which means basically the end of this tubing, but I also need enough slack to kind of make it into this little specimen. So into the container. That's what we'll call it, the container. So now that I have it inserted to a good length, I'd say, it's just draining. So his bladder is draining, and now the stream has come to a halt. So what I'm going to do then is I'm going to go ahead and inch this out very slowly. All right, your bladder's done draining, so now it's removal time, okay? Yep, I told you it won't take too long. You're doing really good. So as I'm kind of inching this out, I'm going to go really slow just in case there are any kind of pockets of urine hiding in there. Another thing I didn't mention earlier, Mr. Jones here is circumcised, but if he wasn't, alrighty, and there we go. That is finished, okay? If he wasn't circumcised, I would have had to pull that skin back to do the procedure, especially the cleansing portion of it. And then once the procedure is over, then I would go ahead and return that foreskin. If you don't do that, then it can really block circulation, which inevitably may result in late circumcision, which is not a very fun healing process for somebody later in life. So with that said, what I'm going to do is I'm going to take my specimen container and I'm going to set it aside so that I can go ahead and clean up my supplies and get Mr. Jones squared away and comfortable. But as I do that, I'm going to go ahead and let go. Okay, so I will explain the urine sample in a second. Let me clean him up. Okay, so I'm just going to go ahead and dispose of all of my supplies, Mr. Jones. And then I'm going to get you squared away, okay? Get you nice and comfortable. All right. There you go. All right. Is that okay? Wonderful. All right, so then I would go ahead and get him all comfortable. But with the urine sample, what I would really assess is, since these containers aren't very accurate to determine the amount of output, I would go ahead and pour it into a cylinder, a graduated cylinder, and then measure it that way. And then I would also determine, the clarity of the specimen. So was there sediment? Was it cloudy? I would also just kind of take notes of the odor. Was it foul? Was it typical? Just, and another thing that is important is the color. What color was it? Was it amber? Was it yellow? Did it look like water? So those are all things that I would document. But also, on a different side of the procedure of documentation is to assess how did he handle it. Was he in excruciating pain? Did he handle it well? And along with that, what teachings did I provide? For an example, did I tell him to drink more water? Things along those lines. So those are important whenever you're in the entire in and out catheter process. All right, bye.